I'm a nurse, and I work in a TB unit for almost 7 years. And 2 years ago, in 2010, I've got TB, extrapulmonary TB. So I experienced the diseases that I was working on with people, and there was a time, a special time, to think about it and knowing more about. It take 2 years because I start with some symptoms before I got the diagnostics. But even the first one was not TB, it was cancer. So just after 22 days, I have a positive culture, and there was confirmed that I really got TB, peritoneal TB. It's very difficult because at the first time I didn't accept that. So we are talking about stigma, maybe we're talking about stigma, and that it was very discomfortable to me because I just face with myself and trying to accept that, because my first answer when I started to getting sick and doing the exams, I really talked to the doctor. If I have a cancer, that's okay because I'll die, right? But if I got TB, I cannot handle with that. That was my first answer. So when we got sick, we definitely are not a nurse. I was a patient, not a nurse. But then I was advised for some colleagues, of course, and I take time to myself to think about it, because I feel very bad, because I was thinking, Tania, you are a nurse, you work on a TB unit, and you are also a trainer, because I do trainer in Mozambique. I train nurses about TB, and I really don't feel bad, don't feel with any problem to be with the patient. Actually, when I got TB, what was telling to me was two things. Oh, you went to Africa for 1 week. Maybe you got TB there. And Portugal is not a high-burden country, but don't have very good numbers comparing in Europe. And the second one was, Tania, you are so too close from with the patients. You stay for so long with the patients. That's why you got TB. So all those things just came to my mind, and I was asking to myself, why I cannot accept this disease. So I started the treatment before I have the diagnostics, because it was a severe status at the time. So I wasn't very good. I was terrible actually. So the doctors decided I got to go into the treatment without a positive result, because I have serious problems even with my heart. So I started, and before there I have a bad reaction to the medicines, which actually could be common. So I've been in the hospital 2 times, and the second time I just stay in my unit. So 1 week I was a nurse, another week I was a patient. But fortunately I was sensitive to the first line medicines, and that was my treatment. Not for 6 months, not for 8 months, but for 14 months. It's very, very difficult. And I could really say, if I don't have the knowledge about TB, I will fail with the treatment, because it's so hard. It's very hard. And we have very bad days that we don't have energy, and we feel like depressed, and we look to all those pills, and you don't feel so good as you want to feel. So many things, we have to lead to many things, and have to be focused and think about it every day. You have to think about the diseases every day. That's why the support from the community and the healthcare workers are so important. To know how to communicate, to know how to give some hope and get motivated and explain everything. You have to involve the patients to the treatment. Yes, I have different reactions, Particularly in my service, in my unit, I don't felt that my colleagues are stigma seeing me with TB because they have 2 years ago they have a very bad experience because another colleague got MDR-TB and died. So I realized that that could be very difficult to them, so they were just great, and I have a lot of support of them. What I just felt was not at the TB unit, but when I went home and go on the treatment, and it was very painful, stressful to go to the healthcare facility because I don't felt like I was treated like a person, because I have to face a doctor that I think she was not very happy what she was doing and always complaining, and I never had support from the nurses over there because they just come to me and give me the pills. But what I realized was just because I'm a nurse, they are expecting that I have knowledge and that I don't need any support. That's what I realized. And it's very difficult because you just felt alone. Actually, I heard that. I'm not a nurse. And one day it was terrible because I just tell, no, I'm not a nurse, I'm a patient. So don't treat me like a nurse because now I'm a patient. And that's why it was so difficult. And that's why I think that I don't get any information or another kind of support that I was expecting for because of that. I think when we think on TB, we saw the conditions, and we are afraid. It's a mix of everything. People are afraid, and we understand that because the disease is spread in the air. So people are afraid, but people judge. I know that what is stigma is. So we are not looking to the people. We are looking to them. Imagine what are they doing or how they're living. So it's very complicated, and we know there is a social problem. The TB just became because of so many problems behind that has so many implications, and we should look at that as an opportunity to improve better life, better conditions to those people. When a healthcare worker has affected by TB, we have to look to the place that professional is working. And in my example, nothing was done. So I have a diagnostic and nothing was done in my unit to improve. I don't know, whatever. And my experience, sharing my experience, could help other persons because when we find someone with the same problem as us, we just feel more comfortable and we just feel, oh, this person will understand what I can share. Support the patients, listen to the patients because everything that patient says is true because it's what the patient is feeling. And sometimes we judge that because of the knowledge that we have about the medicine, the side effects, whatever. Yes, definitely, because I just realized the things in the very different perspective. So that's what I said and what I say today. That now I know what TB is because I have experience. Yes. And actually, when the day we talk about stigma and we do some interesting exercises, it's the best day because nurses just felt very good to know more about it and to express themselves about it. So it's very good. It's very good. And when we do the evaluation, if you have to choose what was the most interesting issue, stigmas, it's always the one chosen.